Good afternoon, everyone, and thank you for being here today. I know that this is part of your nurse-based training. We're going to talk a little bit today about incorporating wellness practices into your everyday work and personal life, and really just talk about how to cultivate a work and life balance. So, we're going to start off just by talking about what is wellness. What do you think of when you hear this word? When you think about practicing wellness, what does that mean to you? Or when you talk with others about what wellness is and how to take care of yourself. There are just listed a couple of definitions that I really liked when I was looking through the research and when I've practiced wellness myself over time. The first one talks about wellness as an active process of becoming aware of and making choices toward a healthy and fulfilling life, a decision one makes to move toward optimal health. Another is wellness is you being and doing your best. Wellness is your life at a balanced optimum. And the last one, a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. So, this is just, again, a couple of definitions, and really there is no right answer because there are a lot of ways to describe and talk about wellness and what it means for each individual person. And what part of our focus today will be is on, not just what is wellness, but how do you begin practicing it and how do you begin integrating it into your own life. So what you see here is an example of a wellness wheel, and I've adapted this one actually from Vanderbilt University's Wellness Center. As you can see, it breaks down wellness into different dimensions that address all the parts of our being. So you see occupational, environmental, physical. Some of these may seem really obvious and others may not. And this is really one of the greatest things about wellness, is that it really focuses on a holistic approach to the person. It just doesn't talk about physical wellness or losing weight or dieting or cramming exercise routines into your schedule. Instead, wellness really takes a step back and it challenges us to look at all aspects of our lives and how we're doing, how we're feeling, how we're thinking, and how we're being as a whole person. And really, an overarching goal of wellness is to foster an integrated self where all parts of us feel satisfied and whole and not just specific components or elements of the wheel. So the first example would be the dimension of physical wellness. And this is the one most people will think of when they think about getting well. They'll think about exercise, eating healthy, reducing risk for high blood pressure or high cholesterol are often goals or motivators for this type of wellness practice. And reducing these can be motivators for engaging in physical wellness practices, for incorporating these things into your life. Cardiovascular exercise can give us, more energy, can create structure in our day, and it can lead to overall improved health. Additionally, and just a side note, according to the Center for Disease Control, the four highest risk factors for development of chronic disease are tobacco, frequent use of drugs or alcohol, lack of physical activity, and poor nutrition. Among our patient population and perhaps among even some of us as staff members, these are issues that we face every day. And so beginning to talk with patients about these risk factors and ways to change behavior to positively impact our health can help change the quality of life that our patients are experiencing on a day-to-day basis. The important message is that can also help you. And if you're not already practicing some of these physical wellness practices, you might challenge yourself to incorporate one or two, to introducing a new practice like drinking more water, changing your sleep hygiene practices. For example, not watching television to help you fall asleep, or powering down all your screens, iPhones, iPads, and computers and telephones before you're going to bed. The next dimension of wellness, occupational wellness, refers to your work and your workplace. And we certainly spend a lot of time in the workplace. We're with coworkers and patients, we're performing tasks, solving problems, and also celebrating successes, all while at work for a lot of our waking hours. Ways to be well at work can include finding satisfaction and worth in your work, finding ways to improve at work through skill development and active learning, um, cultivating an ability to make choices that foster positive attitudes toward work and your coworkers that will then enhance or can enhance your personal and professional satisfaction and promote lifelong learning. Again, when thinking about occupational wellness, thinking about creating balance and integrating all parts of our life to feel whole. Asking yourself the question, do you think about work and home as two separate parts of your life? Or do you think about the workplace as also a place you can take time out to practice self care? And just beginning to explore these questions is a step toward practicing occupational wellness. You can see some other examples are listed there. The next component of wellness that we'll talk about is spiritual wellness, and this can be a very personal aspect of people's lives. It can also mean many, many different things and be incorporated into our lives in many different ways. Some examples here of spiritual wellness are being open to different cultures and religions, giving your time to volunteer or participate in community service activities, caring about the welfare of others, and acting out of that care. A lot of us are doing that every day when we care for our patients. And what's unique about this component of wellness is that it's often an aspect of wellness that is either very much included in people's lives or not really at all. And what you can do is ask yourself in what ways you practice spirituality or what your belief system is based upon. Remembering that this is a practice that can look like anything you want it to. It's not prescriptive, it's not the same for everybody. And really, practicing spiritual wellness often becomes a coping strategy for individuals. As you encounter patients with multiple medical problems or complex psychosocial issues, you might talk with them about this component of wellness and whether it's a sustaining force for them, or whether they've ever thought about what is their belief system. And you can also do this for yourself. A couple of other spiritual wellness practices include really spending time defining what your personal values and ethics are, and how you make decisions that complement your values and ethics. Spending time alone in silence or in personal reflection activities like journaling or just going for a walk and taking in the nature of your surroundings. But again, just remembering that this component is personal and can look different for everybody. The next dimension of wellness is social wellness, and this is also a component that may look different for different individuals. And as you can see, it's a perception of having support available from family, friends, or coworkers in times of need, and a perception of being a valued support provider. This is really, really an important one for people in our lives. It is known that lack of social support from family and friends can be devastating during times of challenge, during times of hardship in life. Managing difficult medical diagnoses, struggling with a substance abuse issue, or being afraid are all things in life better managed when we are not alone. And isolation can cause additional problems and create additional barriers for people in trying to succeed at social wellness. A couple other examples of social wellness include contributing your time and energy to the community. So, through acts such as volunteer work or donating blood, or even just by simply not littering and making an effort to keep your physical surrounding and your community clean. And also beginning to understand and communicate your feelings. The next dimension of wellness that we'll talk about is emotional wellness. And when we think about this aspect of ourselves, we might think about some of the more common emotions, such as anger, joy, sadness. And sometimes these emotions are really associated with negativity, but really it's how we manage these emotions that has the greatest impact on us. For example, if you get mad at your spouse or your children or a coworker, what are your outlets for resolving the problem? And do you use communication and listening to work through a problem? Do you tend to take an extra cigarette smoke break or have an extra drink after work? Or are you someone who avoids difficult situations altogether? If you've had a bad day at work, how do you take care of yourself in that moment or when you get home at night? And emotional wellness is really about a possession of a secure self identity and a positive sense of self regard. Very importantly, it is the ability to cope with and or improve unpleasant mood states. So what we're talking about here is about being positive, learning healthy ways to cope with difficult feelings, difficult situations, and addressing personal and professional issues realistically by keeping positive attitude, by being sensitive to your own feelings. So, not just stuffing feelings down, but allowing yourself to let those feelings come up to the surface, to notice them, and then to notice how you react to them and how you integrate. The challenge is really the noticing part. And so it's learning to observe yourself during these times, starting to notice how you do react to a difficult patient in an exam room or on the telephone, or how you manage yourself during stressful times, whether you're at home or in the community or at work, whether these are spouses or children or patients that you're dealing with and trying to manage a difficult situation with. Just noticing, how do you do that? How do you engage with that situation? And once you start to notice your behaviors, your awareness shifts. And once your awareness shifts and you continue to notice these things, you can start to make changes toward a healthier emotional life. A couple of other examples, just a great one is viewing challenges as opportunities rather than obstacles or barriers. Functioning independently and being assertive and autonomous, but knowing when you need to ask for help. I think that this is a really important one. A lot of people may view asking for help as a weakness, but in reality, it's really a strength to be able to know when you need help and to be able to use your voice to ask for it. So, moving along here to intellectual wellness. This is not a component of wellness I've heard talked much about. You may not have heard the concept before. However, a couple of examples include learning because you want to, not because you are told to, and just doing the work that's assigned to you. Learning through varied experiences like reading, writing, sharing, exploration, observing what's around you, listening. These are just a couple. And really, what I'd like to say about this is that it's about this component is about expanding your knowledge base, applying skills and concepts that you've learned, and it's about being informed. A very important aspect, I think, of this component of wellness is doing things because you want to. That there is an internal motivating factor that comes from you toward learning and education. I think that can make a real difference. Even this webinar is an example of a new skill that you are learning. And how you decide to use the information, how you decide to incorporate wellness into your life is your choice. But it is something that you're learning today that you can make a choice to integrate into your life. Moving on to environmental wellness, it's often talked about or referred to as being quote unquote green. It can include practices such as recycling, being mindful of use of energy and resources, and just in general taking care of the environment that you live and thrive in, taking care of the community that you're a part of. A couple other examples from the literature are being aware of the natural environment you live in, recognizing opportunities that lead you to new skills, and acting on those opportunities, and also working to ensure the stability and longevity of our natural resources. So, things like we talked about recycling and being aware and mindful of how much consumption you're actually participating in when you grocery shop or when you eat, or even when you just go out to the corner store for a couple of items. And again, maybe you've noticed, but woven through a lot of these wellness dimensions is the ability to observe and notice your own behavior. So that kind of concludes the specific components of wellness. And really, this slide is just a very simple couple of pictures, couple of words, and it talks about wellness as growth, wellness as balance, and wellness as absence of illness. So it's very simply stated, and it's just a nice kind of visual for people to think about. It's not just about not having a cold or not having a chronic disease, but it's also about growing in your life and growing to cultivate that integrated self. And it's also about cultivating balance in your life. So here we have just a couple of ways that you can practice wellness, and this is certainly not an exhaustive list, but really starting to ask yourself, how does this wellness wheel fit into your life? And how can you begin to practice wellness right now, during this webinar, after work today? And really the answer is there are lots of ways that you can start to integrate wellness practices right away. I think, and you can see here, you can eat well, you can do breathing practices, you can take the stairs instead of the elevator, you can do that personal reflection or journaling to connect with yourself. You can also be sure to balance that connection with yourself by connecting with others. Increase fruits and vegetables during the day. Again, there's several listed here. This is not exhaustive, and what I think is really of importance is finding practices and exercises that make sense for you, and practices that you know are going to help you to better manage stress or frustration. Practices that are going to increase your energy and reduce your any reactive responses that you may notice you have at home or at work, or any range of emotions that you have, and really learning what works for you to get in touch with your emotions and start cultivating a balanced life. Again, this is a short list, but really the takeaway message is finding what's right for you. So where, how, when? Practicing wellness for a lot of us is going to be about starting to notice our current behaviors. We've talked about that. So really the first step is noticing and observing ourself. And then once we have that awareness, wellness practices can be about change, changing our current behaviors and habits during our everyday life. Really important to remember that you have to start somewhere. So from 1 minute to the next, or one day to the next, like so many other things that are skill based, this is going to take time. And we can start by taking baby steps, and we can start just by starting to know what works for us. But each choice that you do make in your life can impact some component or some dimension of your wellness wheel. Over the next few slides, we'll talk about some exercises that you can explore. And again, it's important to try things out. It's important to learn what works for you. It's important to be open and really maybe think about practicing a wellness technique that you wouldn't necessarily choose as your number one. But just being open, kind of broadening your perspective to things that maybe seem a little foreign or seem like you wouldn't like them, or maybe you see it as an opportunity to choose something new and different just to get informed and to learn about it. I think it's also important to say, when we're thinking about where, how, and when, that we make realistic changes toward our goals, that we do start small, that you reward progress toward your own goals. And when you do start to notice changes or shifts, that you acknowledge those, and you start to see what kind of impact those shifts are having on your everyday life and how you're feeling moment to moment. So the first exercise we're going to talk about is breathing exercises, and we're really going to talk about what is a breathing exercise, and we're going to look at some diagrams, and then we're going to practice. Breathing techniques have been called by many, many different names. There's a couple of them listed here. Sometimes you'll see it as diaphragmatic breathing. Some people will refer to it as belly breathing. Some people will refer to it as simply deep breathing. And there are many more. But however you'd like to call it, the ability to breathe deeply is an inborn skill that we all have. Tapping into it allows us access to one of our body's strongest self-healing mechanisms. And I think this is a really powerful statement about the difference between involuntary breathing and voluntary breathing. Listed on the screen also is a favorite quote of mine by a famous yogi who said, "The breath is the medicine we all carry around with us." And this makes so much sense to us. And as the above statement said, is that it is an inborn skill. So we really are all carrying around, very inborn, this skill to heal our body. Breathing is an involuntary act. We don't have to do anything for our body to breathe. It simply does when we're asleep, if we're unconscious. However, the effects of breathing in a conscious and in a purposeful way can be very positive on our physical and our emotional health. And what's also important to note is that so many things in life, so many experiences that we have, can negatively impact our breath patterns and the way in which we take air into our body and release air and oxygen from our body. People can begin to be chest breathers, and we'll talk a little bit more about that in a minute, or find themselves short of breath regularly due to feeling scared or feeling anxious or feeling nervous about something. And it's during these times where engaging intentional breath and doing breathing exercises in our daily routine can activate a relaxation response. And by doing this, we have the breathing, by doing the breathing exercises and by breathing intentionally, there's a cumulative effect that it has on the body. So the point is that the more we breathe consciously, the more we cultivate a relaxation in our everyday action. And the more we begin to have a calmer inhale and exhale breath pattern in our life. So, what does it do? Why does deep breathing have this positive effect on us, and how does it work? So, as you can see here, the act of breathing engages the diaphragm, which is a strong sheet of muscle that divides the chest from the abdomen. As you breathe in, the diaphragm drops downward, pulling your lungs with it and pressing against abdominal organs to make room for the lungs to expand as they fill with that air, with that fresh oxygen coming in through the body. As you breathe out, the diaphragm presses back and upward against your lungs, helping to expel any carbon dioxide. And we'll take a look at a diagram in a minute. Diaphragmatic breathing, what it does is it allows you to take normal breaths while maximizing the amount of oxygen that goes into the bloodstream. So it's a way of interrupting the fight or flight response, and triggers instead the body's relaxation system. So again, we've talked about this. Breathing deeply, bringing fresh, long inhales of oxygen into the body, engaging, letting that deeper part of the belly fill up, and then exhaling and expelling the carbon dioxide. We're removing toxins, we're interrupting any sort of nervous breath pattern that might develop during a time of fear or anxiety or being scared. Um, and breathing can really be trained for both positive and negative influences on your health. So things like chronic stress can lead to a restriction, of connective and muscular tissue in the chest, which results in a decreased range of motion of that chest wall that's described there. And due to this kind of more rapid, more shallow breathing, the chest can't expand as much as it can with slower, deeper breaths. And much of the air exchange occurs at kind of the top of the lungs, above the breastbone. And this, results in that. And sometimes when people are nervous or anxious, you can see that their breath is even short because they're breathing so high. This is really inefficient, this chest breathing, because the greatest amount of blood flow occurs in the lower lobes of the lungs, areas that have limited air expansion in chest breathers, because you're only breathing up top. You're not breathing deeply into where the diaphragm is. And rapid, shallow chest breathing results in less oxygen transfer to the blood and then subsequently poor delivery of nutrients to the tissues. The good news, and that's a lot of kind of biological talk, but the good news is that just like playing an instrument or riding a bike or learning any new skill, you can train your body to improve its breathing technique. Breathing exercises and breathing techniques are a skill that require practice. So what we have here is just it's a diagram that shows what the diaphragm is doing during the inhalation and the exhalation when we're breathing deeply. And again, deep abdominal breathing encourages a full oxygen exchange. So it's beneficial trade of incoming oxygen for outgoing carbon dioxide. This type of breathing can slow your heartbeat, it can regulate heart rate variability, it can lower or stabilize blood pressure. And again, we've already talked about this, but it also activates the relaxation response in the body. So over time, with the practice of deep breathing, of really engaging our breath in this intentional way, our body will begin to have a calmer response to stress. And linking this back to wellness, and when we're noticing our behaviors at work, when we're on the phone with a difficult patient, when we're on our lunch break, maybe with a difficult patient and we want to get to lunch, when we're talking to a spouse, when we're talking to a friend, any situation that may cause stress or that may be difficult. Over time, practicing these breathing exercises, you may start to notice that you respond differently to these difficult situations. And that's really the inborn kind of the inborn knowledge of the breath work, getting us to a calmer place, engaging our nervous system more toward relaxation versus that fight or flight type of response. So why don't we go ahead and just take a minute to practice some of this deep breathing. I think it's really good. And really, if you get a sense of how you're doing it, you may find that you want to share this skill with patients and encourage them to practice it. So go ahead and place one hand on your chest and the other on your abdomen. You can close your eyes if you'd like, and just go ahead and take a deep breath in. And notice which hand rises. Is it your top hand on your chest, or is it your lower hand on your abdomen? You can also kind of observe if your shoulders move, or if any other parts of your body are moving. And as the slide says, what the goal is to really inhale deeply. So first filling up the belly. So letting your belly, around where your belly button is and below, start to fall out and round as it fills with air. And then you exhale and kind of draw that belly button back in towards the spine. And what we're doing is expelling that carbon dioxide. So go ahead and try it again. Place, if it's still there, or if it's not, if you've moved it, place your right hand on your chest and your left hand on your abdomen. Just kind of sit straight in your chair, maybe put both feet on the ground, and take an inhale through your mouth or your nose. See which part of the body rises more or less. And then exhale. Trying to make your exhale a bit longer. When we deepen our exhalations and we exhale more so, we're really expelling more of that carbon dioxide. Some people refer to that as toxins. So you're really removing stale oxygen or stale energy. And you can practice this as many times as you'd like. You can practice this a couple of times a day. When you're having heightened stress or when you can't sleep, if you're noticing any anxious or racing thoughts about something at work or something at home, if you're noticing that you're extra tired, if you're dealing with a difficult patient in an exam room, or if you're just trying to manage a difficult situation in a waiting room, this is a perfect time to practice this. And just continually try to inhale, filling up the belly, and exhale, expelling that carbon dioxide and really extending that exhalation. And then we're just going to talk for a couple of minutes about yoga. Yoga is another really great practice that can help to cultivate wellness in all parts of our life and in our wellness wheel. Yoga, there are lots and lots of definitions for yoga, just like breathing exercises are referred to so many different things. And one of the definitions I really like is that yoga is the yoking or the union of the mind, body, and soul. So we're really getting back to that idea of wellness and an overarching goal being to integrate all the parts of ourself. And that's what the practice of yoga does too. Also, at the heart of a yoga practice is the quote-unquote cessation of the mind stuff. And so that's really speaking specifically to the activity of the brain, the mind, and thoughts. And what its ultimate goal really is to kind of reduce all of that down to stillness and quiet. If you have a yoga practice, you'll understand that concept. If you don't practice yoga, that may seem impossible or that may seem like a foreign concept to you. But truly, the ultimate goal is to stop the clatter and the chatter of the mind, to help us reduce the raciness or busyness of our mind and instead experience stillness. It can take time. That's why yoga is a practice and not a one-time effort. The breathing exercises that we've just discussed and practiced are also a practice, not a one-time effort. And the effects of both of these things are really cumulative. So the more we engage them, the more we make an effort towards integrating yoga into our life or breathing exercises into our life, the greater the effect on our body and our mind. So what we're going to do now is just do a quick, we might not be able to get through all 8 of these poses, but if you want to go ahead and find yourself in a comfortable position in your chair, if your legs are crossed, I'd invite you to go ahead and uncross them. If you need to make any adjustments so that your feet are flat on the floor, go ahead and tuck your tailbone a little bit, sit up nice and tall, let your shoulders fall away from your ears, and just be looking straight ahead. Drop your arms to your side, and as you're ready, take an inhalation and raise your arms up above like you see in slide 2, and then exhale, bring the hands down through the center and place them on the tops of your thighs. You can slightly look down, really stretching out the back of the neck. Feet are flat on the ground. Spine is nice and long. Take an inhale. And an exhale. Take 2 more. Inhale through your nose. Exhale through your nose. 1 more. Take an inhalation through your nose. Exhale all the breath out. And then gently bring your head back up to looking straight in front of you. Release the hands to your side. Take an inhale. Bring the arms up. And then exhale, fold forward so that you're bringing your chest onto your thighs as you see in figure 4 there. So keeping your feet flat on the ground, inhaling to lengthen the crown of the head out, and exhaling just to really, really fold. And if it's comfortable for you, you can place the entire chest or top of the body on the thighs. Wherever you come, your hands might come to your knees, to your shins, or to the floor. We'll take 3 breaths. So take an inhalation and an exhalation. Take an inhalation through your nose and exhale through your nose. And then very gently begin to start to roll all the way up. Coming back up to an uprighted seated position, you can place your hands, as you see in figure 5, on the tops of your thighs. Draw the shoulder blades down and away from the ears. Take an inhale, and as you exhale, just gently lift up. Keeping the spine long and straight, keeping the shoulders drawing down and away from the ears. Feet are on the ground for 3 breaths. So just inhale through your nose. And exhale through your nose. 2 more. Inhale. Exhale. 1 more. Take an inhalation. Exhale all the breath out, and then round the spine as you see in figure 6, and just really let the head go. The gaze is down at the thighs. And what we're doing here is balancing or counterposing 5. So we're opening the chest and we're looking up, and then we're going to exhale to 6 as you are now to round the spine, really protecting the spine in a nice counter pose. The end of your 3rd breath, go ahead and take an inhale to come back up to seated, and then you can just release your hands, maybe shake out your legs, shake out your arms. And just know, we didn't get to go through all of these, but this is a really nice diagram with 8 wonderful poses that you can practice at any time that you have even just a couple of minutes where you can sit with a chair and do this. Close your office door, if you have a break, you could go in an exam room for a little bit more privacy if there aren't patients and you have a couple extra 5 minutes, and really start to practice these. And as you practice the physical poses, incorporating the breathing exercises with it. So going on to our last slide, just a couple of resources for people. Wellness and cultivating a work-life balance is a really broad topic. Today we've just touched upon some of the main components of wellness, what the dimensions of wellness are. And a couple of different ways to start incorporating wellness practices into your life. And what we have on this last slide are just some resources specific to Massachusetts and specific to Harbor Health that might really inform the manner in which you approach wellness and the way in which you decide or make choices about how to begin to integrate wellness practices into your life. Certainly, I'm available if people have additional questions about any of the material that you saw on the PowerPoint today. I'm also a yoga instructor, so if people have specific questions about breath work or yoga techniques or starting a yoga practice, please, you can contact me as well. Thank you very much.